Okay, so I think we can go ahead and get started. So welcome everyone who's joining us either on Facebook Live or on Zoom. We hope that this presentation today will be informative for you. We are sharing this great webinar in partnership with Horizon, and we're very pleased to have this partnership to bring information out to the community. This is a part of a larger set of virtual workshops on our Building Resiliency, Empowering Parents, Families, and Individuals series. So to learn more about all of those webinars, you can always visit our page at www.uwguc.org/virtual workshops. Without further ado, I'd love to get our special guests kind of going to tell us how to use your health insurance to keep yourself healthy. We're very excited to have you join.
Hi, my name is Elisa. I'm from Horizon Blue Cross Blue Shield. I'm not sure if Iris is starting or.
Yeah, I think she might have had some issues logging on, but I see that she is on now. So
I'll
Iris.
give her a few minutes to see if she can log
in. So Iris, I gave you access to share your slides whenever you're ready. Please bear with us with technical difficulties in this new virtual world.
Hi, Elisa. Hi, Tanya.
Hi.
Hi, Iris. So we just finished our brief introduction, and we wanted to go ahead and get started. You have host privileges, so please take us on.
Oh, awesome. Well, thank you so much for inviting us to present today. My name is Iris Novasconi. I am a community health education manager for the Department of Community Outreach and Member Advocacy. So I'm sorry, I just had a little bit of issue connecting to today, so it took me off kilter. But thank you so much for facilitating today. The discussion today is going to be primarily around prevention health, the importance of preventive screenings, reconnecting with your doctors, and speaking about NJ Family Care and a little bit of Medicaid literacy. To kick us off, I am going to hand it off to my colleague, Elisa, to share some information about NJ Family Care. Elisa?
Hi, thank you, Iris. As I stated before, my name is Elisa Carrero. I am the Community Health Rep for Horizon Blue Cross Blue Shield under Government Program for Medicaid and Medicare Services. I specialize with applications, renewals. If you have any questions within the Medicaid or NJ Family Care, I'm here to assist. And it's that can go from anywhere from changing your primary doctor, case management needs, whatever your concerns may be, I'm here to assist. Really quickly, Iris, are you sharing the slideshow, or do you need me to share it? I don't know.
No, I can share it on my end. Thank you.
No problem. So then we'll just start. Just let me know when you have it up.
Okay, so before we get started today, with the chat feature, if anyone is in need of applying for Medicaid and would like to connect to Elisa, you can connect with her in the chat feature privately, or connect with Tanya at the end to make sure that you're connected to Elisa. Elisa's going to put her contact information in the chat box, so you can connect to her either by email or by phone. And also, prior to going to the prevention health piece, I just wanted to share that during the pandemic, many folks have lost employment and seen significant changes to their income, impacting their food security. Many folks that never thought to have to need going to like food pantries or being out of food or not having food to get you through the week have had this experience, especially now. So we are really trying to capture those folks that may be struggling with food security if they're not having enough to eat or providing food for their families, especially children. You can put it in the chat box privately or again, us via email. We have the ability to share your
waste my tape.
John Ball, would you just mute yourself, please? Thank you. So we have the ability to search your local food pantries. Depending on where you live, we can provide a list of local areas where you can go get food, healthy food for yourself and for your family, because we definitely do not want to go hungry, especially during these trying times. And we want to secure that children do not go to sleep hungry. So if you are experiencing any type of hardship around securing food, please, you can send a chat message to Elisa and let her know. Since I'll be presenting, I won't see the chat. But just let Elisa know if you do have, if you would like that list of local food pantries sent to you. And I'm happy to provide that information. I'm just gonna share my screen. Let's see. No, that's not it. I'm sorry, let me just try that again. Here we go. Okay. It's still not going to where I need it to. Hang on one quick second. Let me see. I just need to close out a couple of things on my end. All right. Here we go. All right. While I'm trying to figure out this end, Elisa, have anyone in the chat box have any specific questions around Medicaid? Feel free to unmute yourself and pose those questions directly to Elisa.
I'm here. Can you hear me?
Yes.
Anybody has any questions in regards to their application process, if they have to do renewals, what your pre-qualifications are, just, I'm here, ask away.
For some, not allowing me to share the screen that I want. So I will talk a little bit about prevention health, and I'm happy to share the information with you afterwards electronically. So during the pandemic, initially when everyone was told to please stay put and minimize the amount of time that you are outdoors to reduce your risk of exposure, many folks were instructed to limit doctor's visits. That is not the case anymore. Many folks with chronic illnesses like diabetes or heart disease, obesity or asthma, or preventative screenings have been put in the back burner because folks were not connected with their doctors, right? So it is really important, especially those with chronic illness, to make sure that you're reconnecting with your doctors. There are ways that doctors can see you, make sure that they treat you, and you're working together with them to keep you healthy, because those folks are especially at a higher risk for any type of complication relating to their illness. But also, if you are exposed to COVID-19, it could really complicate your overall medical wellness. So make sure that you're connecting with your doctors. Your doctors now have a plan where they can either do a telemedicine, where they talk to you over the phone for a doctor's visit, or they use a virtual platform like we're using today to see you, right? Most of the doctors, when you go to the doctor's visits, most of it is a conversation that the doctor is having back and forth with you, right? They review your medical history. They ask you, how you're feeling. Have you monitored your blood pressure? Is your blood sugar changing? Have you been taking your medications? Which medications are working for you and which aren't? Most of this conversation is done in a clinical setting, right? But you can still have those conversations virtually, right? And doctors' offices are now strategically planning these visits and also explaining what they're going to look like. So if you haven't done so already, please connect with your doctors. Make sure that you are going for your well checkups and doing your preventative screenings like mammograms, colonoscopies, prostate exams, oral cancers. There's many different screenings that, depending on your age and where you are in your health, that really need to be done, because remember, early detection is the best type of prevention medicine, right? Before the problem is at a larger scale, we want to identify it when it's still small and you have better options for medical intervention. Another piece too is immunizations. Immunizations is not just an upkeeping of your children's immunizations, which is critically important, but adults too have to get specific immunizations throughout their life, right? There's the yearly flu shots, there's tetanus, there's a slew of preventative vaccinations that adults should get, right? There's like hepatitis and TB, and make sure that you're talking to your doctor to ensure that you're up to date with all your vaccinations, and that if you are due for any of them, you can plan them accordingly, especially now, right? That you're able to go to the doctor, get the services that you need in a safe and secure way where you're minimizing your risk. So with that said, we're gonna transition to talking about chronic illnesses, right? Some of these chronic illnesses are asthma or respiratory illnesses, diabetes, cardiovascular disease like cholesterol or hypertension. All of these are chronic illnesses or common chronic illnesses, especially impacting minority groups. So if you have a genetic predisposition, meaning if you have a family history of chronic illnesses like asthma, like heart disease, like obesity, like diabetes, please speak to your doctors, gauge where you lie in the risk, and make sure that you plan accordingly to keep you healthy. These are conversations that you need to have with your doctors. Remember, your doctors are your allies. So all of your medical team are really there to provide the best care, but you are the driver, right? You are the lead there. They're there to support you. So no one knows your body better than you. So communicating with your doctors, any changes, any transitions, whether they're good or bad, make sure that you're speaking to your doctor clearly and plan accordingly for these screening measures to be done early. With children, I know that currently there's certain school districts that are either completely remote or starting a hybrid, or they may have started hybrid and shut it down. All of these transitions are to be expected, since the pandemic if it has taught us anything, is to be fluid, right? Because we really don't know what tomorrow is going to look like, right? So make sure that you're also doing the same as far as your children's needs. Make sure that they're getting their immunizations up to date, their well checkups, their oral care, and especially their immunizations. There are specific screenings like blood screenings, developmental screenings that are critical, especially now because children have been out of school. That component where the school does that massive intervention along with parents has been disrupted, right? It looks differently. So as a parent, please leverage the resources that you have with connecting to your doctors, but also call your insurance company, ask to speak to a nurse or a case manager and share your concerns, and we'll help you walk through that process to make sure that you are accessing and using your healthcare services as you should, because the goal here is to keep you and your family healthy, right? And everyone has individual needs, right? And we're here to assist with that. Onto COVID-related resources. During the pandemic, many folks have been struggling with mental health and mental illness. Please be sure to incorporate that as part of your overall wellness strategy, right? Not only addressing and utilizing your mental health resources, but also making sure that you're incorporating self-care into that plan. Make sure you're sleeping and getting enough rest. Make sure you're physically active and doing some type or some form of exercise on a daily basis. And again, this is a conversation that you can have with your doctor, because it's not a one size fits all, especially if you don't have physical activity on a regular basis. You don't want to just go for a 5-mile run. You want to make sure you talk to your doctor to make sure that you're healthy enough to start a physical activity regimen. Another piece is to make sure that you are feeding yourself well, right? Your food is really your first source of medicine, right? So what we put into our bodies really does matter. Make sure that you're remembering that Mite Plate method, right, with portions and the proper allocation of fruits and vegetables with lean proteins and healthy whole grains. And drink enough water. We tend to not hydrate enough, and water is a really good component, not only to allow your body to accept all the nutrients that you're taking in, right? But it helps with the absorption and the elimination, right? Elimination of waste, because your body uses all those nutrients for your organs and regular bodily function, but you also need to get rid of it, right? So make sure that you're hydrating enough throughout the day. A good gauge for that is you take about half your body weight in ounces, and that's how much water you should be drinking within a 24-hour period. I'm just gonna stop right there 1 second. Tanya, can you allow Gloria to come in? Thank you. Great. So are there any questions so far? Elisa?
Nothing has come on in the chat yet.
Okay. If anyone has any questions, you can feel free to put it in the chat, or you can simply unmute yourself, and I'm happy to respond to your question. So moving on, make sure that you're eating a balanced diet, right? Making sure that you have plenty of fruits and vegetables in your diet and healthy whole grains, lean protein, meaning you're not consuming meats that are high in saturated fats, because it really does impact your cholesterol, your blood pressure, and other illnesses that are not conducive to your well-being. So feed yourself properly. It doesn't mean that you can never have ice cream. You can enjoy your ice cream, every once in a while. Just saying, don't eat the gallon, eat a little cup, right? Balance. You don't want to deprive yourself, but you also want to look at food as a source of medicine. During COVID-19, COVID-19 is a virus, and the virus family is a coronavirus, right? COVID-19 is that specific type of virus under the coronavirus family. It's airborne, right? This is why the reinforcement of wearing face masks is so important. So when you are out in public, if you're walking and there's no one around you, you can pull the face mask down. But if you are in an area where there's people constantly going back and forth, if you're taking public transportation, if you're going to a supermarket or a pharmacy, anywhere enclosed, you should be wearing a mask. The mask is there not only to protect you, but it protects others of you. Many folks, and again, we're still learning a lot about this disease, but many folks are actively carrying the infection, showing no symptoms, meaning they're not showing signs of fever or body aches or cough or any of the lethargic or feeling tired. They're walking around feeling completely healthy, and they're actively carrying the virus. And those folks tend to be most infectious, right? So please be sure to wear the face covering when you are outside. Make sure that you are monitoring your behaviors, right? Keep hand hygiene at the forefront. Many of us don't realize how many things we touch, and then we touch those areas that are directly bring that disease back into your system, right? Your mouth, your nose, your eyes. So, and because it's an airborne pathogen, airborne means that it kind of stays suspended in the air. The droplets are so tiny, right, that it stays suspended in the air and you can aspirate it, right? Meaning you can breathe it in and it goes directly into your lungs. So again, be mindful of wearing your mask when you're out in public. If you are visiting someone in an enclosed space that you are not living with, right? Make sure that you're wearing a mask. Keep social distance, right? The 6 feet of distance between yourself and others. And again, it's to reduce the likelihood of you unnecessarily being exposed to the disease, because again, it is airborne. So that the hand hygiene component is really critical, making sure that you're washing your hands with soap and warm water for 20 seconds, and you're doing this frequently. In a scenario where you don't have running water, you can use hand sanitizer, but please keep in mind that nothing replaces warm water and soap. Make sure that you're washing your hands thoroughly for 20 seconds, right? Rubbing your hands together, going in between the fingers, getting the thumbs down to the wrists, and getting underneath your nail beds. Anything that we touch, remember that viruses and bacteria live on the surfaces of your hand as well, right? So you transmit it and you can pick it up from surfaces. So be mindful of like wiping things down like your cell phone frequently, right? Things that are touched like doorknobs or sink faucets. Those are common things that people grab onto, like the refrigerator handle or the stove knob or cabinet handles. Again, you're picking up whoever touched it previously, you're likely picking up whatever came off their hands, okay? So be mindful of this by wiping things down regularly, right? In your home, right? Because we're not completely enclosed right now. We are going out and coming back. Make sure that when you come home, the first thing that you do is wash your hands. And also monitor your behaviors when touching like your face, your eyes, your nose, your mouth, because again, this is an easy area for those infections to be transmitted back into your system and expose you to unnecessary, bacteria and viruses. Remember that it's not just COVID-19 that we're concerned with. There's the influenza virus and a whole slew of other bacteria and viruses and germs. So healthy habits not only keep you healthy, but they keep others healthy. And also your children are watching, right? We want to model healthy behaviors. So it's not just for our children. We want to model healthy behaviors for our partners, for our family members, our loved ones, our community. So we really do need to work collaboratively together in order to ensure that we're keeping each other safe and healthy. Are there any questions?
Yes, there is a question. So This person wants to know, how do I take advantage of my health insurance at this time if I am worried about going outdoors because of the virus?
That's a really good question. So there's two parts to that. The part, if you have health insurance, if you have health coverage, and for example, if you're completely healthy, but you want to make sure that you want to circle back with your doctors. So connect with your doctors, call them, at least set up a telemedicine or a virtual visit like we're doing today with your doctors to ensure that everything is up to date, that your vaccinations are current, that any screenings that need to be done are done in a timely manner. Because you have to remember that disease doesn't take a pause just because we're experiencing a pandemic. If anything, it has exposed our vulnerabilities of chronic illness and disease management, right? So be sure that you can connect to your doctors. You could always call that 800 number in the back of your card and be connected to either a nurse or a case manager or a member service person that you can pose your questions and they can direct you to the right department to help answer those inquiries. But I would definitely start by connecting with your doctor. Another piece too, which Elisa, I think you can answer more intently, is especially for Medicaid folks covered under Medicaid, you have to renew every certain amount of time. Could you just speak a little bit to that?
Yeah, so I actually put Horizon NJ Health Member Services number on the chat box if anybody was interested in or needed it. Also, we do renewals every year, so normally we would be getting them in the mail. They are starting to start submitting them throughout this term. They had suspended it for a few months. But just always be in the lookout to see when it is your turn to do your renewal. It is every year. You normally could see it on your start date on your actual your member ID card. And if you need to get in contact with me, my number is available on the chat box as well. And I can assist as far as doing an application or a renewal, or if you have any questions regards to changing doctors or doing anything that you may need to do with your insurance policy.
Thank you for that. Does that help answer your question, whoever asked it?
I'll keep checking the messages to see if it did. In the meantime, also, there was something else. So people have been hearing a lot about the health insurance enrollment period that is coming up. You could just share a little bit about what that means and how can people be prepared for it?
So the enrollment period for the marketplace starts on November 1st, and they're extending it till January 30th this year. And that's for the marketplace, not necessarily for Medicaid. Right now, we're on open enrollment for Medicaid, which is technically throughout the year. You can come in, but during this period, you can change your doctors without any repercussions. If you need to change your actual carrier, meaning your HMO organization or your health management organization, you could do that during this time as well, during their open enrollment for Medicaid. So that's October 1st till November 15th.
So if anyone throughout today's chat would like specific information around any chronic illness, what types of screenings you should have as an adult. We have tons of literature that I'm happy to share with you. And I also have quite a bit of literature around COVID-19 safety guidelines from the CDC that I'm also happy to share with the group. Also, please let us know if you'd like a list of local food pantries. We are happy to share that information as well. Are there any other questions, Tanya?
Not that I know. No.
Okay, great. So just a quick recap. Please be sure to self-care. Make sure that you are looking to see exactly what it is that you need as far as keeping you healthy, addressing any type of chronic illness, or preventive screenings and immunizations, especially as adults. Please go get your flu shot if you are able. Connect with your doctors, as it has never been a more important time to keep yourself healthy, right? And then watch your behaviors around hand hygiene, touching of your face, and also, wearing a face mask when you go out, social distance, and keeping surfaces as clean as possible. Keep wiping them down, especially those surfaces that you touch frequently, like your cell phone and door handles, any type of handles in the home. Clean them frequently, and again, connect with your doctors. That phone call really, it makes a huge difference between keeping you safe and healthy, and the likelihood of things getting complicated unnecessarily. We are here to help, so please leverage us. Again, my name is Iris Novascuni, and thank you for having us.
Fantastic. Thank you so much, Iris and Elisa, for joining us today and providing such important information during this unprecedented times that we are going through. So thank you again for your time. Feel free to contact Elisa or Iris directly with any other questions. This was also live stream on Healthy Playing Field. We'll be happy to connect you to them as well if there are any other questions. Otherwise, we will have our 3:30, a little bit behind, session in Spanish next. Thank you all.